suppose what I'd like to say is I think the most important thing is to provide mentorship and support. And certainly, you know, when I started off in medicine, the senior ranks of the profession were absolutely dominated by men. I mean, there's no question about that. We were 50-50 in my class in medical school. But once you started getting into hospital medicine particularly, it was hugely predominated by men. And I have to say, most of my mentors along the way were male mentors, not female mentors, because they just happened to be in those positions. And I think now that I'm lucky enough to be at the stage where I can identify people and support them, I think it's critical to identify to supports to help people with their career progression. But I think another thing is, as a woman, and I'm finding, thankfully, much more now, people think an awful lot more about their personal lives, what their family lives might be. And I really think it's important to enable people to make decisions about whether or not they want to have families, because that's very much a personal decision. But to also to understand that certainly in my experience over the last number of years, stepping out for a while, to have your family, to have a little, spend a bit of time with your children, it is not the career no-no it would have been 25 or 30 years ago. In fact, it's very much an acceptable part of the career trajectory. But I think there are younger women out there who've worries about that. You know, find somebody who's in your business or even outside of your business who is in a leadership position and whom you know is a family person, and identify with them and talk to them about it. It's really important to identify and support our younger women coming up through the ranks.